Mr. Johnson. My name is Sandra. I'm one of the nursing students at NTC. How are you today? Well, that's nice. I'm here because the physician ordered for you to have an IV placed in your arm. Are you familiar with that? Oh, good, you are. Okay, so just as a reminder, it's a small needle that I use to insert into your arm. The catheter stays in the vein, the needle comes out, and it allows us to give any medications or fluids as needed through the IV. Is that okay with you? It is, great. Can you tell me your name and date of birth again, please? Mark Johnson, 10-484. Okay, fantastic, thank you. I'm just confirming that. And I am taking a look at my MAR here, and I'm confirming that I have Mark Johnson of the correct date of birth, and that there is an IV lock that has been ordered for this patient, and he does not have any allergies or iodine allergies. I've already provided privacy for my patient. I've gathered my supplies, so now I'm going to go through those supplies now. I have a 20 gauge IV that will work for fluids and or medication. I have a saline lock, a flush, 2x2, Tegaderm, alcohol prep, tape, some additional hand sanitizer, a tourniquet, and I'll be starting the IV on the left arm because Mr. Johnson told me previously that he's right-handed and he would prefer to have it over on this side. There aren't any complications, no previous surgeries, fistulas, or anything that would prohibit me from using this arm for an IV. The bed is already at a comfortable level for me because I'm going to be sitting down. My supplies are ready, so now I'm just going to get those things prepared for the IV start. So I'm going to start with my flush, remove the cap. I've already removed my lock from the sterile packaging, and I'm going to connect the two. Ensure that there are no air bubbles in the syringe, and I'm going to flush some fluid into the lock to ensure that there are no air bubbles in the lock either. I'm just going to slightly loosen the cap, but I'm not going to remove the cap. Now I'll set that down. I have my 2x2 open and ready. Mr. Johnson, do you have any questions about the procedure that I'm doing today? No, you don't? Okay, so my patient is able to follow commands, understands the things that I'm asking him. Okay, that is ready to go. Prepare my tape. I have a new 20 gauge IV here. I'm going to remove from the packaging and just loosen the cap until I am ready. So I'm going to go ahead and apply the tourniquet. 15 to 20 centimeters above the site that I'm going to be using. And I'm going to wash my hands again. And I don't want to leave that tourniquet on for any more than 2 minutes, or any longer than 2 minutes, so I'm keeping an eye on the time as well. Putting on my clean gloves. Mr. Johnson, can you make a couple fists for me on your left hand? And he does, to allow the vein to pop out. So I'm going in a circular motion outward, and he does not have any obvious debridement that would cause me to believe I need to clean the site again. So I'm going to remove the cap from my IV, pull the skin taut with my non-dominant hand, 15 to 30 degree angle, 1, 2, 3, poke, and I have a flash, so I'm going to advance my catheter, pull back my needle, remove my tourniquet, apply pressure. My needle has been sharped. And I'm applying pressure to stop the blood flow from the site. And I have applied my saline lock, and now I'm just going to hold this. Make sure I don't move it. I'm drawing blood back. And after I put the tourniquet on, I would also check a distal pulse to make sure my tourniquet is not on too tight, but Mr. Johnson wasn't complaining of it being too tight either. And just do a little extra cleaning here around the sides, and now I'm ready for my tegaderm. Okay, tegaderm is applied. And I'm just going to use the clean part of my 2x2 to clean any excess blood. And I would change the padding from below too and clean the back of his hand. Okay, remove my supplies. And now I'm going to tape according to agency protocol. I'll remove the excess part of my tegaderm. Mr. Johnson, when I was flushing that saline, did you have any burning or tingling sensation, any pain? And he did not. And I had already flushed it and had drawn blood back, so I know that the IV is patent. And with a clean paper marking, I would mark the my initials, the time, the date, and the gauge that I'd used, and I would tape that down here. And just one more measure to secure it and make sure that other nurses know the type of very sticky stuff. Make sure that they know when I have applied that. And as I'm taping, I'm always making sure that I'm not kinking off the catheter here where the insertion site is. And then I can apply one more piece of tape here. IV is locked and it is ready for use for the next time. Very sticky tape. All right, so my IV is taped. It is properly placed. I'm gonna remove any excess waste and I will be throwing that away. My needle has already been sharp, so I'm just setting that to the side for demonstration purposes. I'm going to clean up my station. I'm going to remove my gloves. I'm going to wash my hand again. And considerations would be if Mr. Johnson is very elderly, I want to be cautious of the skin, preventing skin tears or any damage. If he's very young, I know that they can have a little bit more fragile veins and possibly some sensitive skin as well. The bed is at a comfortable height. He has his call light. He's comfortable. Sit him up if he needs to be repositioned. And I would document my IV, the type, the date, the time, the patient's response to the IV, and anything else that would be significant or pertinent to this patient. Clean my hands again and done.